Hello everyone. Uh, Today, the 24th March, is commemorated as World TB Day. Why it is important? Because this day in the year 1982, a German doctor, Dr. Robert Koch, he announced in a conference that he has found the germs which cause tuberculosis. And it's an irony that the first TB drug was invented almost 70 years after that. That is streptomycin in the year 1948. We all know that tuberculosis is a very important disease for the mankind, which, which is prevalent all over the world. And it's not a new disease. Almost 9,000 years back, this was prevalent. This is historically known. And in Egyptian mummies, when they dissected it, they found evidence of tubercular bacilli, which they called as consumption disease because it consumes a person. Why it is important? Because one-fourth of the world population is infected with tuberculosis. And as many as 17 lakh new cases of tuberculosis occur all over the world. India has a distinction because India harbors one-fourth of the tuberculosis burden of the world, whereas we are one-seventh of the population of the world. Now, there are as many as 16 lakh people die every year all over the world with tuberculosis. And in India, 2.2 lakh people die with tuberculosis. And with that, tuberculosis remains the number one infective cause of mortality, despite the fact that it is eminently treatable, it is curable, and the treatment in India is available free of cost, and also the diagnostic facilities. So, therefore, we will talk about tuberculosis as to what is tuberculosis, what are the symptoms, how it is transmitted, and how it is treated, and how can we eradicate it from the world. So tuberculosis is caused by a bacteria which is called bacilli. It is called Mycobacterium tuberculosis. As I said, it was detected by first Dr. Robert Koch on this very day. This enters the body through lung. It is transmitted by from man to man. When a person has lung tuberculosis, then whenever he breathes, coughs, sneezes, he throws out millions of bacilli in the air, which which are inhaled by the people which are around. And this is how it is transmitted. Before the Going into the history, before the we had treatment for tuberculosis, the patients were treated in the sanatoria because it was realized that it is transmitted from person to person. To prevent transmission of the disease, people were kept in the sanatoria where there was fresh air, good food, with the hope that it will not be transmitted in the community. Unfortunately, 70% of these patients died within a period of 10 years because there was no treatment for that. So let us understand what are the symptoms of tuberculosis. The commonest symptom for tuberculosis are fever, cough, sometimes sputum is also contains blood, what we call as hemoptysis, chest pain, weight loss, and loss of appetite. As we understand, these are very common symptoms. But sometimes the tuberculosis patients have these symptoms for months and sometimes years even without a diagnosis. That is why the government of India announces that anybody who has cough for more than 2 weeks and not getting better should be tested for tuberculosis. So tuberculosis is of mainly two types. One is lung tuberculosis, what is called pulmonary tuberculosis, and the other one is extrapulmonary tuberculosis. That is tuberculosis occurring in organs other than lung. And tuberculosis can affect any and every organ of the body. You leave aside hair and nails, that's all. It can affect lymph nodes, lymph glands as it is called. It can affect brain, it can affect eyes, it can affect bones, it can affect skin, urinary tract, gastrointestinal tract, and accordingly, the symptoms are present. If it is in the brain, then person will have headache, he may have paralysis, he may have convulsions, what is called as epileptic-like fits. If it is in the eye, it will have symptoms of eye involvement, variety of type. If it is in the intestine, it can have diarrhea, constipation, pain abdomen, and so on and so forth. Tuberculosis of spine is also very common, but the commonest among the extrapulmonary tuberculosis is lymph nodes. And 80% of the TB cases have lung involvement, and extrapulmonary occurs only in 20%. How do we diagnose it? The diagnosis is very easy. We ask person to give sputum for testing, and it is examined under the microscope. And if it shows acid-fast bacilli, we say it's TB. It can also be cultured, which takes 10 to 14 days for positivity. But now we have biotechnological based test, what is called as gene expert, which gives results within a period of 2 hours, and which also gives an indication whether it is a drug sensitive tuberculosis or a drug resistant tuberculosis, which I will be talking about little later. As far as the X-ray is very important. These people, along with sputum examination, should also undergo X-ray, and it gives an indication that person have tuberculosis and what is the extent of tuberculosis. Sometimes we have resort to the CT scans also for diagnosis of other lung conditions. But the extrapulmonary tuberculosis is little difficult to diagnose because the general symptoms are same, like fever, weight loss, feeling unwell, night sweats. But the other symptoms will depend upon the organ which is involved. So any patient who has any symptoms, along with this symptom, what we call as constitutional symptom, one should suspect tuberculosis, and accordingly we do imaging tests and also do biopsy, and on the biopsy we can, and which is sent for culture, we can see the bacteria, as well as there's something called granulomatous inflammation, which gives an indication that this is tuberculosis. So coming to the treatment, that is quite easy, I would say. That previously, the olden days, the treatment was for 18 to 24 months. Now it is called short course. Short course is not 6 days, it is actually 6 months. And we treat patient what we call as category 1 drug with 4 drugs. For first 2 months, we give 4 drugs, and after next 4 months, we give 3 drugs. All these drugs have significant side effects also, and those have to be usually monitored with the liver function tests, because about 5% of patients will have liver injury, which will have symptoms of loss of appetite, vomiting, and jaundice and pain abdomen, as it occurs in jaundice. So, if we take treatment for a period of 6 months, then this disease is cured completely. I also want to tell you that isolation is not required, because in few weeks' time of starting antitubercular treatment, person becomes non-contagious. So he is not a threat to anybody. But there is a problem which can emerge, what is called as drug-resistant tuberculosis, and what you would have heard, MDR tuberculosis. It's a very fancy name. It is multi-drug resistant tuberculosis, when there is resistance to two main drugs for tuberculosis, namely rifampicin and isoniazid, then we call it MDR tuberculosis. In olden days, I'm talking about 40 years back, there were editorials saying that it is like a death sentence, because it is very, very difficult to treat, and within a short period of time, a person succumbs to it. So why does MDR develops? When the tuberculosis was detected, there was no MDR. But when you start treating a patient with antitubercular drugs, if the drugs are insufficient, or if they are given in insufficient dosages, or there is non-compliance, that means that when you start treatment for tuberculosis, the person stops treatment in between because of the adverse effects, or because he thinks that he's already well, or because of whatever reasons. And if he subsequently gets tuberculosis, it's more likely to be MDR tuberculosis. So there are two types of MDR tuberculosis. One is, now when this patient develops MDR tuberculosis, then he transmits to the another person. So his bacilli are already drug resistant. So what other person gets is called as primary MDR TB. And the person who has taken treatment before and is second times gets tuberculosis, because the same bacteria have become resistant, it is called secondary MDR tuberculosis. Now, treatment of MDR tuberculosis is available. It is usually, the conventional treatment is for 18 months, and it is difficult to tolerate. But if taken properly, it can be cured also. So how do we diagnose MDR tuberculosis? The diagnosis of MDR tuberculosis is by culture sensitivity test, and also by doing a biotechnological based test, which is called Gene Expert. And also there are other line probe assay and other tests are also available in advanced laboratory, which will give results within a period of few hours. So what can we do? The government of India has launched a program. Previously, it used to call the National Tuberculosis Control Program. Now, this program is called National Tuberculosis Eradication Program. The WHO has kept a target of 2030 for eradication of tuberculosis from all over the world. But the India government has put a target of 2025 and named the program as National Tuberculosis Eradication Program. If we are able to detect all the cases of tuberculosis and we are able to give treatment to all the patients and cure all the patients, the tuberculosis transmission would stop and we'll be able to eradicate tuberculosis from this earth. For that, a commitment is required, and awareness about this disease is required, and compliance to the treatment is required. And it will not be out of context to say that diagnostic facilities as well as treatment facilities are available free and to all the extreme corners of this country by the government of India. And the treatment is given directly observed that because some of the community worker actually sees to it that patient takes medicine regularly. So let us take pledge on this day, 24th March, that is World TB Day, to end TB as the Honorable Prime Minister envisaged from our country and also from all over the world. Thank you very much.